Thank you, Scott. We're hoping to be able to go directly to the presentation by Dr. Don Monath. We think he is connected.
Good morning,
remotely.
everybody. And
Tom, good morning.
Thank you for the invitation. I'm so sorry I can't be with you there. I was defeated by the weather yesterday. And thanks for inviting me to this important meeting. I was going to cover 4 different topics listed here, including any potential influence of climate change, covering some slightly different aspects of the potential for establishment of an enzootic cycle in the Americas, the possible role of direct transmission of the virus from human to human without the agency of mosquito vectors, and then some of the critical gaps. Next slide, please. So I think we have to accept that climate change is happening. There's a predicted significant continuing increase in global surface temperatures. These are data from the United States, and you see almost a 4-degree increase compared to baseline values over the last decade or 2 decades. Next slide. So what is the influence of temperature on transmission of Zika and other arthropod-borne viruses? Temperature in many, many different models has been shown to be really the most important factor limiting or contributing to virus transmission, because it prolongs mosquito survivorship and shortens the extrinsic incubation period. That is the period of time between taking a blood meal with infectious virus and the infection of salivary glands of the mosquitoes and the ability to transmit. And that is a temperature-dependent interval. Rainfall also contributes, and both, of course, temperature and rainfall are linked to climate change, both due to the warming of the Earth's surface and also these extreme climatic events, such as El Nino events, that many times have been linked to the emergence of arboviruses, including yellow fever. And now, of course, these events in the Americas over the past 2 years are at least temporally associated with one of the largest El Nino events on record. And we've seen northern extension of Egyptian albopictus in Europe, which seems to coincide with the period of increasing temperatures. Nevertheless, this linkage between climate change and arbovirus transmission is really speculative at this point. We don't have any really good research that shows empirically that there is a link, and so it's an association. And I think for the U.S., the major result would be the longer transmission season for both of these important vectors, Aedes aegypti and Aedes albopictus, in the United States with climate change. Next slide. This map, which is taken from a recent paper, which deals with temperature in particular and its influence on dengue transmission, shows a temperature suitability index. It's really an index or a measure of the influence of temperature on oviposition of the vectors, Aedes aegypti and albopictus, and the potential for transmission. And the 2 species are quite similar in having the highest temperature suitability indices in the tropics. But if you look at the map of the United States, the southern Florida, southern Texas, and southern California are areas with higher color, and these are the areas that have been affected by indigenous transmission from time to time of dengue or even chikungunya. So I think those are the areas of concern, and with changes due to climate change, this picture could expand northward. Next slide. Now, Scott has mentioned the association of, or isolation of Zika virus from Aedes mosquitoes in Africa. And he mentioned the possibility that there is an indication that alternate transmission cycles involving different hosts may apply to Zika. The species listed here, isolated from different countries in Africa, are often those associated with chikungunya and yellow fever transmission, and suggest that they play a role in the transmission cycle of non-human primates in the forested region and moist savannas of Africa. And the colored dots show you the association of these species with both Zika as well as yellow fever, chikungunya, and sylvatic dengue. But Zika has been isolated from many other species, those not associated with the colored dots. And these species sometimes have general feeding habits not specific to non-human primates, and does suggest, along with other factors, that alternative sylvatic transmission cycles may occur. That's an area that needs to be studied, and I would just re-emphasize Ron Rosenberg's point that we no longer have in place the ongoing field studies and research that occurred during the Rockefeller virus laboratory days, 1951 to 72, and continued by the Institut Pasteur, but much of that infrastructure is now really gone, and we're at risk of not knowing what we don't know. Next slide. So Scott Cleaver suggested that there could be an enzootic, or establishment of an enzootic cycle, such as occurred with yellow fever when it was introduced over 400 years ago into the U.S. And I've just contrasted what we know on the left about yellow fever and on the right about Zika. Zika is only introduced a year and a half ago into areas where there could be spillover into a zootic reservoir. Obviously, this happened with yellow fever on the left at some point in time. It's kind of a reverse jungle fever event where humans were the source of infection for mosquitoes that circulate and bite at the canopy level and can transmit between non-human primates. A genus, Haemogogus, as well as Sabethes, are involved in that cycle, and we know nothing, as pointed out on the right, about the potential for Haemogogus or Sabethes, the yellow fever vectors, to transmit Zika virus. They would be the leading candidates for establishing an enzootic cycle in non-human primates of the Americas. So we have no data. As Scott mentioned, transovarial transmission or vertical transmission occurs with Zika in African mosquitoes. It occurs with yellow fever and Haemogogus, and there are no studies of vertical transmission in Haemogogus, of course, and we actually don't know very much about the African species either. And then monkeys in the New World develop often fatal infections with yellow fever. African monkeys are resistant. They get silent infections but contribute to transmission. And so we really need to know something about the susceptibility of New World primates to Zika virus to assess whether they could play a role in enzootic cycles. Next slide. Next slide, please. Now, one point is that yellow fever today, on the right, is confined to the Amazon and Orinoco forests in South America, but that's not always been the case. And in the early 1950s, an epizootic of yellow fever spread up Central America all the way to the U.S. border. And there are Haemogogus mosquitoes and plenty of non-human primates in Central America, Mexico, and even in the Caribbean. And so yellow fever demonstrated its potential to invade a part of the Americas all the way up to the United States. And I think that with regard to Zika, we have to consider the entire tropical region as an area for potential enzootic transmission of Zika virus. And if that were to occur, we would then have a reservoir that would be potential for repeated reintroductions into the human population, and no way to really control it without vaccination. Next slide. Now, recently, just in the last few weeks, there have been reports of a mysterious disease killing howler monkeys in Nicaragua, and also in Ecuador, and a few cases in Panama. Whenever this happens, one suspects yellow fever because howler monkeys are highly susceptible to lethal infection. They drop out of the trees and are found sick or dead on the forest floor. It's a good surveillance tool for yellow fever. And so one has to wonder what's going on in Nicaragua and Ecuador now. It's in region in Ecuador outside of the yellow fever zone. These animals have CNS signs, hepatitis, and renal failure. And studies are in progress, but next slide. One of the issues is there's a big network of primatologists working in Latin America on the biology and ecology of non-human primates, many of which are endangered species. And I can tell you that it is proving very difficult to work up the samples from this Nicaraguan epizootic, if you want to call it, because of permitting restrictions on getting samples out and into the United States or out and into any other country that are really due to the requirement for the CITES permit, which is CITES, the Convention on International Convention on Endangered Species. And there are other permitting problems, just getting materials out of a country and into the United States or to another appropriate laboratory. And I really think that we need to facilitate this process if we're going to have an appropriate surveillance system for Zika virus as an enzootic infection in non-human primates in the Americas. Next slide. So what are the potential for persistence of Zika virus in the Americas? Obviously, there's plenty of human hosts that are effective viremic hosts and mosquitoes, and it could just be here perpetually in that cycle as dengue and perhaps chikungunya are. There's some evidence that the virus may persist in the human host or maybe animal host, potentially immunologically privileged sites, and that there is potential for direct spread, of which I'll mention more in a minute. Sylvatic cycle we've talked about. It could extend further than the current yellow fever cycle. Probably not a direct threat to the continental U.S. in non-human primates. We don't have enough monkeys here, and the primate centers are too small to sustain transmission. Vertical transmission in Aedes, we know very little about that with Zika. And alternative vectors, other species. We've seen in Africa other isolation of Zika from multiple Aedes species, suggesting the possibility of other hosts being involved in the transmission cycle. And actually there are similar findings with yellow fever, and people have looked very hard, have not yet found alternative cycles of yellow fever virus, although there have been isolations from ticks, there have been isolations from bats and with yellow fever, and I think we just simply don't know enough about the potential for alternative vectors or hosts. And if there's an enzootic cycle in the U.S. and non-human primates established, we should be especially wary that other species like marsupials and perhaps sloths would be involved in transmission based on their first encounter with this virus. Next slide. So finally, let me take up this issue of direct transmission. Sexual transmission will come up in discussion at this meeting. Obviously, there's congenital transmission, contamination of the blood supply. But what about direct contact spread? Next slide. So we really don't know much about the viremia levels, and for Zika, seems to be similar in duration to other viruses being transmitted by human biting mosquitoes, but data are really needed to assess the potential for vector-borne transmission and blood contamination transmission. Next slide. There is a suggestion, as mentioned by Scott Weaver, that the virus has adapted to human hosts, at least with respect to the codon usage of one of the non-structural genes, which seems to show changes of adaptation to humans. This may indicate that humans are more effective viremic hosts or in spreading the virus through other means. And that's specific to the Asian type. Next slide. Zika virus has been isolated from and or shown to be present by PCR in urine, lasting a lot longer than the viremia, out to 10 days. There's some individual patients' profiles down on the bottom of the slide, showing the upper curve being detection of virus in urine, and the viremia appears to be quite short. Next slide. And similarly, a study in Tahiti, looking at 182 patients and days after onset, and the virus present, this is not quantitative data, but virus present in saliva, lasting up to a week or so after onset, actually more frequent than in blood. So it seems like most of the viremia is probably in the incubation period with Zika. We need to understand that better, to understand the transmission cycle, and there certainly appears to be potential for shedding saliva and urine, maybe other secretions. That is an area for study. Next. So finally, a couple of slides on what some of the critical gaps are. We clearly need to understand the relative contribution of the two major species in Zika transmission. I think when experimental studies are done, it's not often the design, but we really need to understand the minimum infectious dose. These need to be dose-response sort of studies to define that, and then to link those data with viremia patterns in humans. Will other mosquito vectors play a significant role in transmission? In particular, the susceptibility of hemogobus, I think, is really important to understand with respect to the enzootic cycle. Could Zika adaptation for more efficient transmission by Aedes or humans explain its emergence? Dr. Weaver's mentioned this, and there seems to be some evidence for adaptation in the NS1 gene that may play a role in enhanced replication in humans. What's the magnitude of risk for transmission in different regions of the U.S. that may be temperature related, and there may be other alternative vectors other than Albopictus that are present in the temperate region that could play a role, and that could come out of experimental testing of other Aedes species in particular. Prospects for reducing transmission through vector control, I think Dr. Gubler will speak to that. Next slide. Last slide. What is the role of asymptomatically infected people in as amplifying hosts? And again, we don't really have the profile of viremia and an understanding of the role of humans as effective viremic hosts. Human-to-human transmission, we need to know more about shedding. In particular, needs to be quantitative studies as well as epidemiologic studies that would detect direct transmission. I think we've covered the issue of an enzootic cycle in previous slides, but just emphasize that we need to make use of primatologists who are out there in the field. We need to go back to principles of the Rockefeller Foundation days and conduct appropriate field studies involving vertebrate biologists and things we just don't do anymore. And then what are the interactions between Zika and other related flaviviruses? It may be that the absence of microcephaly in Africa is in part due not only to Zika immunity, but cross-protective immunity from related viruses, which is very prevalent in Africa and Asia. And we need to understand the interactions of these viruses in vectors, as well as the role of immunity in cross-protection and potentially enhancement. So I'll stop there. Thank you very much for your attention.